Welcome to More Than Medicine, the podcast from Zeam Health. This show explores how integrated psychiatry, primary care, and aesthetics come together to support the whole person, not just isolated symptoms. Each episode is grounded in clinical insight, real-world care, and the latest research, helping you better understand your health and the options available to you. Whether you're navigating mental health, managing a chronic condition, or thinking about preventive or aesthetic care, this is where medicine connects. Let's get started.
Treatment for anxiety attacks. What to do before, during, and after. Your pulse spikes, your chest tightens, and for a few unbearable minutes, you're sure something has gone seriously wrong with your body. If you've been through an anxiety attack, you know how disorienting it can feel in the moment and how confusing it can be afterward, trying to figure out what happened. The good news is that there are concrete things you can do before, during, and after an episode, and there's a clear point where those coping tools give way to real treatment for anxiety attacks. This guide walks through all three stages. What is an anxiety attack? Anxiety attack is a phrase most people reach for instinctively, but it isn't a diagnosis you'll find in the DSM-5-TR. It gets used to describe everything from a slow buildup of dread before a big event to a sudden wave of physical fear that seems to come out of nowhere. Clinically, what people often mean is a panic attack, a sudden surge of intense fear or discomfort, sometimes tied to an obvious trigger and sometimes not, according to Cleveland Clinic. Many people call the experience an anxiety attack, while a provider may describe it as a panic attack or a symptom of another anxiety disorder. One attack also doesn't mean you have panic disorder. Panic disorder generally involves repeated, unexpected attacks followed by at least a month of worrying about the next one. What it can feel like. Every episode looks a little different, but there are patterns. On the emotional and cognitive side, people describe a sudden feeling of overwhelming fear, a sense that something terrible is about to happen, trouble concentrating on anything besides the symptoms, or feeling strangely detached from themselves. Physically, an attack can bring on a racing or pounding heart, chest discomfort, shortness of breath, sweating, trembling, dizziness, nausea, or tingling. These sensations are real. Your body isn't malfunctioning so much as overreacting. NIMH describes panic attacks as a kind of false alarm, where the body's built-in danger response fires too strongly or at the wrong time, and a racing heart can then get misread as proof that something is genuinely wrong, which only ramps up the fear. Before symptoms escalate, preparing and catching early signs. This stage has two parts: building a plan ahead of time and learning to catch the early signs before they build. Many people notice a pattern if they pay attention, whether it's muscle tension, shallow breathing, racing thoughts, or a rising urge to leave a room. A therapist can help you map your own sequence so you're not caught off guard every time. From there, a short, simple coping plan goes a long way. Your early warning signs, breathing or grounding technique you already know, a place you can go to settle down, someone you trust to call. Practice breathing and grounding while you're calm, since skills you've rehearsed are much easier to use once your thinking gets foggy. The VA National Center for PTSD recommends slowing your breathing and staying present-focused, like keeping your eyes open and noticing where you actually are. Sleep, regular movement, steady meals, and cutting back on caffeine also support your nervous system between episodes, though none of that replaces real anxiety treatment if attacks keep happening. During an attack, what helps in the moment? Start by ruling out a medical emergency. Panic symptoms can look a lot like a heart problem, so don't assume new chest pain or breathing trouble is just anxiety. Sudden chest pressure, pain that spreads toward your arms, back, neck, or jaw, or trouble catching your breath are all reasons to call 911 rather than wait it out. If you can't tell whether it's your heart or your nerves, let a medical team make that call instead of guessing. If you've been evaluated before and recognize this pattern, naming it can help create a little distance. This is a wave you've felt before, and it will pass. Slow your breathing at a comfortable, steady pace rather than forcing big gulps of air. Grounding can pull your attention back to the present. Try looking around and naming what you see, noticing the chair supporting you or focusing on one simple task. If it's safe, move somewhere quieter, loosen tight clothing, sit down, and put off any decisions that can wait. If someone's with you, ask them to stay close, speak slowly, and skip the just calm down. After an attack, recovery and watching for patterns. Give yourself time to recover. Feeling drained or shaky afterward is common, and easing back into your day beats forcing yourself to snap right back to normal. It can help to jot down a few details while they're fresh. When it happened, what came before it, main anxiety symptoms, how long it lasted, what helped. Tracking attacks over time makes it easier to spot triggers and see whether your current approach is actually working. Keep an eye on avoidance. It's natural to want to steer clear of wherever an attack happened, but sidestepping driving, stores, or work can quietly shrink your life while reinforcing the fear underneath it. Additionally, try to meet the whole experience with some compassion. An attack isn't proof that you're weak or failing to cope. Progress with this stuff is rarely a straight line. When to reach out to Zeam for anxiety treatment. If attacks keep coming back, growing more intense, or starting to shape your daily choices, that's usually a sign it's time for more than coping tools. Watch for severe anxiety symptoms that feel hard to control, new physical symptoms you haven't had checked, or attacks that are interfering with sleep, work, relationships, or driving. A primary care visit can also help rule out contributors like thyroid issues or medication side effects. From there, real options exist. Cognitive behavioral therapy, CBT, is considered the gold standard for panic disorder, helping people rethink how they interpret anxiety sensations and gradually reduce avoidance. Exposure-based approaches, in person or through online therapy, and medication, when appropriate, can all play a role depending on your situation. At Zeam, we know how isolating recurring attacks can feel, and we're here to help you build a plan that fits your life, whether that starts with individual sessions or our anxiety group therapy. Reach out to Zeam to schedule a consultation and take the next step toward feeling steady again. Thank you for listening to this episode of More Than Medicine by Zeam Health. Next week, we will discuss EMDR online and how telehealth and telepsychiatry are breaking down barriers to mental health care. Until then, have a great week.
Thanks for listening to More Than Medicine. If today's episode sparked questions about your own health or helped you understand your options more clearly, you're not alone. At Zeam Health, we provide integrated psychiatry, primary care, and aesthetic services designed to support your long-term well-being. To learn more or schedule a visit, head to zeamhealth.com. We'll be back soon with another conversation focused on care that goes beyond the surface.